After multiple children in the city die from the flu, local officials are stepping up efforts to get more people vaccinated free of charge. State Senator Jose Peralta and Elmhurst Hospital set up a shop at the Lafrac City apartment complex earlier this week. That's where a young child recently died from the virus.
We want to spread the word. Get your flu shot because it's so important. Some people may say, oh, well, it's not going to do anything. It's not going to help. Yes, it does. It will help.
And that is not all. Jamaica Hospital Medical Center is also ramping up efforts to fight the flu. In fact, the hospital adopted the Outpatient Antibiotic Stewardship Initiative, which aims to educate people about the misuse of antibiotics. Dr. Alan Roth is here to talk about that initiative and more. Doctor, thanks for coming in with us.
Thanks for having me.
So before we talk about the flu and how you know you have it and what you should do, I want to talk about this initiative. Tell me what it's about and why the hospital is doing this.
So nationwide, there's a huge overuse of antibiotics treating flu and other viral infections. Doctors need to be educated and patients need to be educated that antibiotics are only indicated for a bacterial infection. So if you have a viral infection such as the flu, antibiotics are not helpful at all, and in fact, they could be harmful.
How often do you see the patients getting these antibiotics incorrectly or perhaps saying they want antibiotics even though that's not really what they should be having?
So unfortunately, it's on a daily basis. Many people think that antibiotics cure everything. You go to the doctor, you don't feel well, you need an antibiotic. And it's tough for doctors in busy office settings to have detailed discussions with patients of why they shouldn't get it. And sometimes the doctors often say, colleagues of mine, you know, I've had the fight, it's easier for me just to, you know, write the prescription and give it to the patient. But unfortunately, there's many harms associated with that.
So how do you go about that? Because it's not easy to change human behavior, right? As you said, a lot of people just think, I take medicine and I feel better. How are you educating people about this?
So we start by educating our physicians and then we educate our patients. So we have posters throughout the hospital. We have small pads that we give to patients explaining their illness and what kind of medications they should be taking to help their symptoms and get better. So it's tough. You know, the patients think they want it and it's a challenge. So it takes a lot of education. There is more national efforts from the CDC and other agencies because of what we're seeing with the overuse of antibiotics right now.
So have you seen success with the initiative so far? Have you seen any difference in terms of how many people were being incorrectly prescribed these antibiotics?
Absolutely. So in our institution, we're working with the United Hospital Fund on an antibiotic stewardship program, and we've already seen in the first year about a 65% reduction in the use of antibiotics total, and even a greater decrease in the use of inappropriate prescriptions of antibiotics. Treating antibiotics for colds, for example, upper respiratory infections.
Well, it's great that that is working. Unfortunately, though, so many people are still getting the flu. We're seeing people are scared. You know, it's such a deadly flu season. Have you seen a flu season like this before in your years of experience?
So we do see it. It's common. There's a lot of publicity this year, I guess, because of some of the deaths that we've seen. But nationally, about 50,000 people die each year from the flu, so it's not that uncommon. This year, unfortunately, the flu shot is not as effective as it's been in the past. And because of that, we're seeing increased numbers, and it started earlier than it normally has.
Why is that? Why is it not as effective as it normally is?
So each year, a new strain of flu vaccine is manufactured based on predictions of what's going to happen that flu year and what strains. Most flu vaccines have either 3 or 4 strains within the flu shot. In those strains are, like I said, the CDC and national experts come up with what's best for that. This year, unfortunately, the most common This year, unfortunately, the most common strain that we're seeing is the H3N2 strain. And the H3N2 strain is the most virulent strain that's out there.
And what are these symptoms? And like you said, we hear it again and again on the news, but it's important to get it out there for people. What are the symptoms that people should be looking out for if they may or may not have the flu?
So some of the classic symptoms of flu are fever, chills, body pain, dry cough, runny nose. Very rarely GI symptoms, but not commonly, and not other symptoms really associated with it to explain the condition.
So again, antibiotics, not the way to go. So if they are seeing those symptoms and they are diagnosed with the flu, what should people do?
So people should see their physicians. It's important that they get treated. We know that antiviral medication, such as Tamiflu, is extremely effective in decreasing the duration of the flu, decreasing the symptoms of the flu, decreasing the risk of significant morbidity, which is side effects of the disease like pneumonia, decrease your risk of dying, as well as preventing other people from getting it.
And I want to know, is there anything that you want to put out there to people who are maybe skeptical of the flu shot? Because you often hear every single year, oh, I'm not getting the flu shot because I heard this person got the flu shot and then they got sick from it. I mean, are there any myths about it that you want to set the record straight on?
So there's total myths out there. The flu shot is safe and the flu shot is generally effective. Unfortunately, this year not as effective, but people should still be getting the flu shot. We know that by getting the flu shot, you still have a decreased incidence of the severe side effects such as pneumonia. You have a lower chance of hospitalization and a lower chance of death, as well as preventing the flu.
So people still can get it now? It's not too late?
So the flu shot is widely available. It's all over. Many sites, as you've just mentioned, are giving the shot away for free, so people should get it.
Dr. Alan Roth, we appreciate your insight, and hopefully many people will listen to you and they will be getting that flu shot. Thanks for coming in.
Thank you.
When we return, there's much more news straight ahead right here at the Queen's Week in Review. Stay with us.